Hello. We are over 40 days into the lockdown and the measures that have been kind of forced upon us by the present situation. As you can see, I'm in my surgical scrubs and I am actually in at the Mayhill this morning, but we are still closed to routine care. I've had to see a few emergencies this morning, and these are people who are in desperate need. Thus far, with advice, analgesia, and on occasion antibiotics, we have managed to hold most issues at bay, and I'm still happy to report that we've not had to send anyone to the UDC or accident emergency. But I feel this is becoming more and more difficult, and I know we're expecting some announcements this weekend which will hopefully give us some a way forward. But I know it's getting very difficult for many of our patients, and I can only I feel apologetic because I don't think we're giving you the standard of care that you deserve, but our hands really are tied, and we have no discretion with this, and we are doing our very best to help those patients in need. I have to also thank the pharmacies in Monmouth who've been brilliant, particularly the Well pharmacy, the one near Waitrose. They've managed to raise lots of prescriptions for us, and they've done so without any fuss or issue, which is certainly not the same as other pharmacies that I've had to deal with in Cardiff, Newport, even London. So a big thanks to them. It is difficult to say when we're going to come back and what we're going to do. I have to say that we are preparing for that now. We are making progress with PPE. All the dentists in the practice are making themselves completely up to date with the risks that are obvious from COVID-19 and how that's going to impact on dental practice. We're due to have a meeting this week to finalise our strategy in the anticipation and hope that we're going to be back fairly soon. But I have to say, in terms of reassurance, dental practices have been at the forefront of management of cross-infection for many years. I'm old enough to remember the scares that we had with HIV and AIDS. We've had similar issues with mad cow disease, Creutzfeldt-Jakob, and dentistry has always been able to come back stronger after these scares. And I feel that of all primary healthcare settings, patients are safer in dental practices than they would be elsewhere. I feel even now that if you have to come into a dental practice, you're probably safer here than you would be at your local petrol station or at Waitrose or doing your local shop. So I feel confident that we are going to come back, and our practices, it's certainly going to be a different feel. The waiting rooms are not going to be full of people, and sadly we're not going to be able to offer you a magazine, a coffee, that kind of thing. For the moment, is going to have to be dispensed with. It is going to be a sort of one in, one out kind of system, but it's a system that won't be there forever. We hope things will return to normal, but in the meantime we have got to be mindful. We're going to have to listen to the advice that we're given, even if there's some of us like me don't necessarily believe that the advice is correct. When we do come back, we will be focusing on those patients who who have great dental need at the moment. We must see them. Secondly, we've got to see patients who've got treatment in progress and at least make sure that they're stable. And then we've got to get general patients back. And we will obviously be concentrating initially on our practice plan patients who need to be seen and get back into their routine. So for the moment, we're waiting with bated breath. I can hear that Quick Fit in the background are open. They don't seem to have any problems with cross-infection control, changing a tyre, but we've got issues, and we need to be mindful of that and listen to government and our public health bodies. But we want to come back, and hopefully this weekend we will see some guidance in that. So until we next speak, Once again, please stay safe, look after your family members, and we've still got to maintain the social distancing. Thank you.